Hi, everyone. I'm Nicole Oliver. I am a doctorally prepared family and acute care nurse practitioner from Greenwood, Arkansas. I'm also currently in an MBA program so I can learn more about the business of nursing. I have worked in the emergency department since 2001 in both nursing and advanced practice capacities. I teach classes through ENA, and I was inducted into the Academy of Emergency Nursing's Fellow Program in 2020. I have been happily married for 13 years and I have a wonderful and precious 17-year-old special needs son. I am seeking a position on ENA's board of directors so I can help advance the emergency nursing profession. I have worked on several different national committees and councils at the nursing and advanced practice levels through ENA, and I would really like to have a greater impact on emergency care. As a board member, I can influence emergency nurses by building on impacts I have already made and leave behind a lasting vestige that will continue to guide the emergency nursing profession. I can continue to work on the national level as well as contribute to the emergency nursing profession by performing ongoing research that will bring latest evidence to the front lines of ED nursing and advanced practice. And also, I'm in a unique position because I can help bridge the gap between nurses and providers in the emergency care through my experiences as both to help us work more synergistically to care for our patients. Today's emergency nurse needs information regarding self care. As ED nurses, we're pretty much just programmed to push down and ignore our emotions, but our resilience has definitely been tested over the past couple of years. Self care is so important right now. Mental health resources like webinars, counseling resources would be really helpful. Lately, I've read about ED providers who have committed suicide due to the increased stress during the pandemic, and I have personal experience with this because one of our ED providers attempted last year. It's so disheartening to me, and I would really like to see more resources for our members to hopefully try and prevent this from happening any further. Burnout is also rampant amongst emergency nurses. This pandemic has really tested each of us in several different aspects of our lives, and we are constantly exposed to people who incessantly need something from us, and it's just physically and emotionally exhausting. The United States is number one of the top 10 active countries in publishing documents on burnout and compassion fatigue among healthcare providers, and burnout numbers among healthcare providers in the US range from about 35 to 60%, and in some other countries, it's even higher. I read a recent statistic where it said that since the pandemic, a third of nurses have actually just left the field altogether, and that is just astounding to me. Emergency nurses need to be aware of the signs and symptoms of burnout and steps to take in order to renew their love for nursing. I have read studies and I actually read several different books about this, but one of my favorites had micro steps, which are defined as tiny science based actions you can start taking right away to build habits that significantly improve your life. That includes things like taking your work email off your phone so that whenever you are off work, you are disconnected from work. I don't know about you, but kale smoothies and yoga and pizza parties and things like that just are not doing it for me. Taking some of these micro steps that I read about has really helped me personally, and I actually don't dread going to work every day. I know ENA has partnered with a